Here, everybody. It is me again, the MA Mentor. How are you? Hope you're doing well today. As promised, I've got kind of a follow-up to a previous video that I posted on microbiology. This one will be discussing lab and point of care testing, which has a lot to do with microbiology and infection and diagnosing and things like that. So without any further ado, we will go ahead and get started with that and jump right in. And as always, if I could have you hit the like and subscribe buttons, it really helps me out, helps the channel to keep going and growing, and enables me to bring more content to you. So that would be great if you could do that. But let's go ahead and jump in, not to this. All right. So let's talk about labs. There are certain types of labs out there, categories, if you will. One is a reference or an outside lab. These are your freestanding labs that you see in cities and towns that perform more modern, complex testing. These are the labs that, if you're working in an office setting, this is where you would send your specimens out to be tested. And then there's the physician office lab, or what we call the POL, which is basically the lab area that's within a doctor's office or a clinic. And if we do any type of, you know, uh, rapid testing or CLIA waived testing, which we'll discuss here in a little bit, or point of care testing, which we're going to be discussing, that's where that would take place. All right, so how's infection diagnosed? That's kind of a good jumping off point and where to kind of start with all of this. So infection is diagnosed by a provider. Always keep that in mind. As a medical assistant, we are not allowed to diagnose. It's a big, 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 giant no-no. You might do it in your head. And when I was a medical assistant, I did it in my head a lot. What you have to be careful of is just don't let it come out of your mouth. Guys give you a lot of legal trouble. It's way outside of our scope of practice. But diagnosing the infection, the provider diagnosing the infection, is good to understand so that you can learn something from it. Obviously, a lot of what I know was kind of doing that in my head and then seeing if I was right. But also, just in the whole process, it's good to understand. So, infections diagnosed through patient examination. The provider comes in and takes a look at everything. Specimen collection, direct examination of the specimen, and we will talk about all of this. Testing the specimen, whether it's through culture, sending out, or rapid testing in the office. And then, of course, physician-determined treatment after a diagnosis has been made. The types of specimens that we're going to talk about today are throat culture, blood glucose, influenza, urine, HCG, which is also a pregnancy test, and wound specimen collection. So let's talk about rapid strep A throat cultures first. Okay. The supplies that are needed for this are a tongue blade, which is this guy right here, or a lot of people call it a tongue depressor. Gloves. We always wear PPE, especially gloves when we're dealing with stuff like this with a patient. A biohazard disposal bag, which you should have in your office and or lab, or the room rather. And then a rapid strep A testing kit. I put lit. I apologize for that. And that's what this is right here. So that includes these little test tubes here, which are what you see right here. They have a nice little stand for them in the kit. A sterile cotton swab, a reagent liquid, two of them, the yellow top and the red top. These are controls, which I can explain to you here in a minute. And then a testing strip, which comes individually wrapped like this, and that is your strip, okay? Now, different manufacturers have different little setups. They look different, but they're all basically the same. And they do come with this control reagent. And basically what controls are for any of these types of tests are it's a fake or a not fake version of what you're testing for, basically. Let me explain that. So in this case, rapid strep A, you're testing for strep A. The result of this test is either going to be negative or positive. They're either going to have it or it's going to detect it or it's not going to detect it. So what these controls are is one of them is positive and one of them is negative. And it'll say that on the bottle. When you open a brand new box of any of these tests, and these are the point of care tests that are that we do in office, okay? Anytime you open a brand new box, you're basically doing quality control or quality assurance on it. You take one test, so one strip, okay, out of that box, and you run the test like you normally would run the test, but instead of putting a specimen from a patient in it, you drop the negative or the positive. In most places, policy is that you do both, and test it. If you put the positive in and the test strip shows positive, yay, it's working. If you put the negative in and the test strip shows negative, yay, it's working. And the reason we do that is to make sure that the tests we have are valid. Now we do, they all have expiration dates on them, so we always check the expiration date. But in addition to that, we want to make sure we got a good batch. And these are created in batches. So that's why we only have to take one test out and test it, because if one of them's good, theoretically, they're all good. If one of them's bad, theoretically, they're all bad, okay? Usually have a log in an office to keep track of doing these controls, or many offices will just take a Sharpie and write on the box QC'd, quality controlled, and then put the date and the initials of the person who did it. That way everybody knows that that open box has already been checked. This is something that we do with all of the in-house tests, and they all have varying types of quality controls in them. Like this one has a liquid. There's certain ones I know I feel like it's the influenza. There's no liquid that you put in with that one necessarily. So it has a control swab. The swab itself has either the negative or the positive on it. So either way, you're taking some type of reactant and using it in place of the specimen. Okay. So that's doing running controls when they say that. Okay. All right. So how do we run a strep? So we've got all of this. We'd have all this set up. And then here's the great thing about these types of tests. They're so easy. And I mentioned CLIA waived in the beginning, and I don't have a slide for this necessarily, but let me explain to you what that means. CLIA stands for Clinical Laboratory Improvement Amendment. This happened in 1988. Don't ask me why I know that. I've been teaching a very long time. They came out basically with an amendment that said, or well, was aimed at making sure that testing was regulated or controlled somehow. And in that, they kind of divided the types of tests up into what labs do, which is moderate or complex testing that you can't necessarily do in an office, and then what you can do in an office. And the ones that they determined were easy enough to do in an office and had the least amount of error possible, they gave them what they call a waiver, meaning you didn't have to have necessarily, you didn't have to be a lab technician in order to do these things. MA training was good enough, kind of thing. So that is why they're called CLIA waived, okay? So any of the tests that you do in office are going to be CLIA waived, okay? Or what they then started terming point of care testing. And the great thing about these kinds of tests, as I was saying, is they all come with directions. Usually they're right on the inside of the lid of the box, which is great. What we used to do is once we'd have an empty box, we would actually tear the lid off if we didn't have one already, and we would tape it to the inside of one of the cabinets. So that way, if you like forgot one day or were really tired, you could just open it up and go, oh yeah, that's what I gotta do. So for strep A, here is what you do. You take 4 drops of one of your reagents, and then 4 drops of the other reagent. This is a little misleading. They both go in the same tube. Okay, so 4 drops of yellow or red, 4 drops of yellow or red, into the tube. You collect your specimen, and we'll talk about how to do that here in a minute. Once you have collected your specimen, you put that into the tube, swish it around about 5 times. You don't have to sit there and go 1, 2, 3, about 5 times. Okay. Wait for it to sit for about a minute. And again, it doesn't have to be exactly a minute, but about a minute. And then you're going to pull the swab out. Now, these tubes are plastic, so you can squish them. So the best way to do this, because this is cotton, right? The swab is cotton, so it's going to absorb not only what you took from the throat, but also that reagent liquid. As you're pulling the swab out, kind of squeeze the sides of the tube, and I just twist a little bit, because then it kind of wrings all of that out of the cotton. Don't do it too hard though, because you'll pull the cotton out, and then the cotton's in there, and that's a big hassle. Okay, but do that so you have as much of the reagent and as much of the specimen as humanly possible. Then you're going to put your strip in, and there's a little line on the strip that says max. And that is going to sit in there for, this one says 10 seconds. Okay. Many of them, it's several minutes. Some of them it's 2 minutes, some of them it's 5 minutes. Make sure you read the specific brand that you have because they're all a little different. And then it even shows you how to read it. Okay. So all of these test strips, all these ones that come with test strips, have a C and a T line. Okay. The C is the control line. That line should always come up because that means the strip is working. If the T or the test line comes up, that means you have a positive. So 2 lines means positive. And anybody who's taken a pregnancy test knows this, right? But that's why it's like that. So for a positive, you would have both lines. If you have just the control line showing up, but not the test line, that's a negative. If you have no lines or the just test line and no control line, those are invalid. That means either the strip is not working or you did something wrong and you should try and retest. Okay. Now, as I said, once you have your specimen, you put it into the tube and swish. Here is how you get your specimen. And you're going to take the specimens from the tonsils. So when someone opens their mouth, sticks out their tongue, you use the tongue blade or the tongue depressor to push their tongue down and hold it down because otherwise people go, okay. It's just a reaction or reflex. Okay. Then you are going to visualize the tonsils, which are on either side of the back of the throat here. And this is the uvula. The reason we have our patients say ah is because when you say ah, the uvula goes up. You want to try really hard not to touch the tongue, this inside of the cheeks or the uvula with this swab. I know, easier said than done, especially when someone's gagging at you, right? But the way I do it is I just go in as quick as I possibly can, get a little bit here, and I kind of do a little figure 8 number and get a little bit here and come out. And that is good enough. Okay. All right. Moving on. This is a transport swab. Now, there may be some, this is a rapid test that we just did in office. It should give us results right away. In the event that the provider either is not happy with what the results on the rapid test said, like it said negative, but he's just sure that they've got some kind of infection, he may ask us to take an additional swab like this and send it to the lab to be cultured. Okay. Here is how this works. Okay. These come in a sealed wrapper. When you take them out, you unscrew this, okay, and that lid comes off, this portion here. Collect your specimen like you did with your other swab, and then put this whole thing into the tube, and then this becomes the new lid. So you want to push it down and make sure it's secured. You label it, you put it into one of these specimen bags. They come in various sizes, and you send that off to the lab with a doctor ordered requisition of some kind, whether it's paper or electronic. Okay. All right. Next on to blood glucose. Blood glucose. What you need for a blood glucose test, which is basically just a finger stick, and it is measuring the amount of sugar in the blood. You need a glucometer. This is your very, very generic glucometer. You need test strips, a lancet. Here are various types of lancet. That's what you actually do the finger stick with. Alcohol swabs, 2x2 gauze, a Band-Aid, some gloves, a sharps container to throw the used lancet into, and a biohazard disposal bag. Okay. Now, very important. The test strips that you use for the glucometer have to match. So if you have, brand X glucometer, you have to have brand X test strips. If you have brand Z test strips with the brand X glucometer, it won't work. Okay, so you have to make sure the brands match. Okay. The type of lancet you use will be partially based on what your office buys and sometimes your preference. These little guys right here are my favorite. They're pressure lancets. I think all of these are pressure. It's a button, but it's square. It's easy to hold. You take the lid off. You put the this end right here up against the finger, and you literally just push it down, and the pressure releases the lancet and does the sticking of the finger. Okay. But again, it just really depends on what your office has. Okay. As far as how to perform this, you will choose a finger. The third and fourth digit, so the middle finger and the ring finger, are generally the best fingers because they're pretty juicy, so to speak. And they're not used as often. You also want to take a look and make sure there's no scarring or injury or anything going on with the fingers. Clean the area with an alcohol pad and let it dry. So clean it off real good with the alcohol pad. While it's drying, you would go ahead and insert your test strip into the glucometer, because 99.9% of the glucometers out there today, the test strip is what turns the glucometer on. So once you insert the test strip is when the glucometer will go on and be ready to accept blood. The problem with putting it in too soon is the longer it sits there and is not used, it will shut off. So that's why I say clean the area. You want to let that dry because you don't want to push alcohol into an open wound. So while that's drying is a good time to put your test strip in. Puncture the skin with the lancet and dispose of it immediately into your sharps container. Allow a drop of blood to form and then wipe that away. You always wipe away the first drop, because the first drop of blood or capillary blood that comes out of a finger is primarily plasma, and there's not a whole lot to test there. It's not going to give you as accurate results. So wipe that first drop away, go ahead and allow a second drop to form, and then you're just literally going to touch the tip of the test strip that is sticking out of the machine, so you have to actually pick the machine up, to the blood droplet, and it will suck it up into the strip, and your machine will start doing a countdown to give you a result. Once you have that result, document it and dispose of your supplies. Influenza A and B. There are rapid test kits for this. Basically, all you need is the test kit, which has a sterile nasopharyngeal swab, a test cassette. That's what this is. Okay. Here are your control swabs like I had mentioned before. Here is the test cassette. Here is the reagent, which is a liquid, some gloves, and a biohazard disposal bag. Basically, what you do with this, and because it's nasopharyngeal, this is the one that you feel like you are touching your patient's brain, but you are not. You go back, not up. Okay. A lot of people make the mistake of going up with these. You actually go this way. So this way. Okay. Um, the diagram's a little further than you have to really go. What I do is the minute I see my patient start to wince, I'm good. That's where I stop. You're going to pull that out. You will have already in these cassettes. Let me actually go back. It's a little misleading here, but this is shaped like this. Okay. You will have already taken your reagent liquid and put it in this little well right here. Once you get the nasopharyngeal swab out with the specimen on it, you are going to stick it into, you'll see a little hole right here. Let me see if it shows that on here. Yeah, see there's a little hole right here. Okay. You'll stick that swab into there. You will give it a little bit of a spin, wait for about a minute, take it out, and then you are going to go ahead and tip the cassette up, which allows the liquid to flow into where the results window is. And most of these will tell you to give it a little tap as well, just gentle tap. And then you lay it back down flat. And then you give it about 10 to 15 minutes to interpret the result. Now, the difference with these is you have the control line, which should come up every time. But then you have a B and an A because these are allowing you to test for both influenza type A and influenza type B. If both of them should pop up, you're positive for both. That doesn't happen that often. It can happen, but it doesn't happen that often. Otherwise, if there's a positive result, it's usually going to be A or B. And then you document those results. All right, moving on to your analysis. Your analysis supplies needed are a specimen cup, which is this guy right here, reagent strips, gloves, biohazard bag, and I throw in here a tidy towel. Tidy towels are, some people call them tidy towels, some people call them polys. They're basically about this big. Well, you can't see my hands, but about a 1 foot by 1 foot little square pad that is paper on one side and plastic on the other. Always good if you are dealing with something that could spill or drip or something like that, to have that down underneath what you're working on, just to keep it clean. And then what you do is you go ahead and if you are doing a clean catch, let's go back to how you have them have the patient do this. If you're doing a clean catch, which most you want to do a clean catch, you will hand your patient a BZK, which stands for benzalkonium chloride swabs. They kind of look like alcohol swabs, so be careful. Nobody wants to be cleaning their genitalia with alcohol. It would burn very badly, so don't do that. So make sure it says BZK on it. Okay. You're going to give a female a couple of those and a male one. And for female, you just tell them to separate the folds of their labia and then clean from front to back on the inside there. Basically, what that's doing is when the urine starts to flow, it will not bring any extra bacteria with it into the cup. For males, they just need to, in a circular motion, clean the head of their penis prior to urinating. Then they are to open the container. Do not touch the inside of the container. Let them know. Begin to urinate into the toilet and then bring the container into the urine stream. They do sometimes refer to this as midstream clean catch. Replace the lid and then bring it to us or put it in the little window, whatever the setup at your office is. All right, once you have said urine, you will then note the color, the clarity, and the odor. Color generally can be anywhere from, people say clear, and people that drink a lot of water, their urine kind of looks clear. There's always going to be a slight tinge of yellow. So it can be light yellow all the way to amber, and everything in between. Amber looks like beer. Okay. Clarity is either clear or cloudy, and you can look through the cup and basically tell whether it's clear or cloudy. And then odor can be anywhere from slight to pungent. And no, you don't have to stick your face into the urine cup to smell it. Just take the lid off and literally hold it up and just waft it like a fine wine. Okay, you'll smell it. And every urine has smell to it, whether it's very, very slight or very, very odoriferous or pungent. Dip the strip out of your reagent bottle here into the urine, tap off any of the excess. I lay it across the top of the cup. Makes it easier for me. What you don't want to do, and what you'll see people do, is hold it up to the bottle to compare it, because then you get urine on the bottle and you're going to be reusing that bottle. But then you're going to read and record. Now, here is what you're looking at on the bottle. Notice here. Okay. Each line represents the little squares on the strip. Okay. Notice there's also a time here, and it starts from 30 seconds down here, and it's all the way 2 minutes up here. So what you want to do is compare, or hold the bottle next to the strip. Don't lay the strip on the bottle. I hate when people do that. It's gross. And you will, starting at the bottom at 30 seconds, start reading it and marking off, whether you're marking it on a piece of paper or you're, a form, or you're clicking into a computer, the results. And basically what you're doing is you're comparing each of these colors with what is showing on the strip. So if on the very bottom here, like this one, is that even dipped? Yeah, it looks like it is dipped. Okay, this one is closest to this color. That's a negative. Okay. The next one looks to be maybe a little darker. Hard to tell from the picture, but we could maybe call that a smaller +1. Okay, or 1+. And then you just go up, because by the time you get to the top, you're usually at about 2 minutes. Okay. And just mark each of these as you go. If you do, and this does happen, where you'll see a color on the strip that doesn't really match the color on the bottle, just do whatever is closest to it. Okay. It doesn't have to be exact or perfect, just whatever is closest to it. And then you record your results and you are done with that. Now, another urine test that we do in the office too is called an HCG test. HCG stands for human chorionic gonadotropin. Say that 5 times fast. And that is the hormone that is released when a woman is pregnant, or more commonly, or more accurately, when a fertilized egg has implanted itself into the uterus. So that is why we test for that for pregnancy. Funny kind of fact. After the second trimester, I think it is, or about halfway through the second trimester, the amount of HCG starts to dissipate to where it eventually becomes nothing. So you could have, like, a 7-month pregnant woman and give her a pregnancy test and it'll say negative, because there's no more HCG. I used to love to do that in classes and freak people out when I had a pregnant student. So what you need here is a urine specimen cup, an HCG test strip, which is what this guy is, or a cassette. They come in both. A tidy towel, some gloves, and a biohazard disposal bag. Again, because this is CLIA waived or point of care, you're going to have how to. So for the cassette, if you notice, it comes with a little, I call them turkey basters. They're actually called pipettes, but they'll be turkey basters to me. You will take your urine specimen and just pull up a little bit of urine. You're going to put 2 to 3 drops of that urine into the little place that says S or specimen, and then you will wait. Okay, this one, this is a generic how-to, so it does not say how long to wait. Both of these are generic how-tos. Each manufacturer will be different. The HCG cassettes, well, both of them really are usually about 5 minutes, 3 to 5 minutes. Okay. Here is your positive. Notice it doesn't matter how dark the line is. If it's there, it's positive. Here's your negative. Here's your invalid, just like on the strip. For the test strips, same basic concept. You're going to dip the strip in. You're going to let it sit there, though, for about 5 to 10 seconds. Pull it out, lay it flat. This one, oh, I'm sorry, does say 3 minutes. And then again, here are your result types. Okay. All right, wound specimens. Wound specimens are anything that the provider wants you to take the specimen of, okay? And that can be a boil, a abscess, a cyst, an actual wound, laceration or anything like that, an ulcer. And again, we're going to use our transport swabs. Now, some wound transport swabs come in the same type, but have 2 of these sticking out of it, 2 of the swabs sticking out of it. That is perfectly fine. This is kind of just a basic generic one. And then, of course, your transport bag and your gloves. And basically what you do is twist the cap off, like I had mentioned before, take the swab, place the swab into the wound, and twist it to cover the entire surface. So this is just a picture here where you get a little bit of pus. You'd want to go ahead and stick this in there and then just twist it around so it covers the entire surface of the swab. Replace the swab into the transport tube and secure, and then label and place it in the transport bag, and off it goes to the lab. All right. Lastly, we'll talk about direct examination. Some providers really like to do this in office where they just get a bit of a specimen and look at it under the microscope. There's 2 types of mounts for this. There's a wet mount where we use sodium chloride or saline, 0.9%. The specimen is put onto the slide like this. Just about a drop or so of the sodium chloride. You put a cover slip or just another slide. I like to just sandwich it between 2 slides. It's easier. And then put it under the microscope for the doctor to look at. There's also what they call a KOH mount, which is potassium hydroxide. Same procedure, specimen, 1 drop, 10% KOH. Put a cover slide on, and then you have to let that one sit for 30 minutes before they look at it, because it has to break down the keratin. And they usually do KOH when they're looking for a fungal infection. So vaginal, definitely. Sometimes feet. Just depends. All righty, so that is it. And again, like I said, if you haven't already, please hit that like and subscribe. It super helps me and I really appreciate it. And I will see you all next time. Take care.